Hello everyone, I am madiwalar and today I'll be giving a presentation on an overview on audio, signal, speech and language processing for COVID-19. My paper is based on signal processing. Let's talk about the coronavirus first of all. There are more than 4 million confirmed cases of the coronavirus all across the world. All across the world in more than 200 different countries, which has led to an increase of diagnostic screening, awareness, and other post-care equipment method for a huge population, which only demands for a larger population. And the effective solution of each stage for the psychological and behavioral problems. And for the diagnostic purposes, WHO, that is World Health Organization, has described the COVID-19 key symptom as high temperature, coughing, breathing difficulty, and there are many other symptoms, including chills, shaking, pain, headache, sore throat, and etc. These since the coronavirus was so new that it was such a unique, it had very unique symptoms of the virus, and the human immunity towards it still found to be different from person to person. There are cases that there are still non-infected individuals with no symptoms can still be a carrier of the disease. Uh, Due to these uncertainties, it was not very easy for people to handle the disease very well. There are false alarms that AI-based diagnosis would generate. Continuous self-monitoring of suspicious individuals can help in at least de-accelerating and eventually stopping the disease. Speech and other audio applications were used for checking up on COVID-19, like sleep quality detection, like chatbot development, stress detection, mask monitoring, which we'll further see in the presentation. As per World Health Organization, the mental health due to COVID-19, their rates increased as well because of social distancing and quarantine, and which affected heavily on people due to loneliness, depression, and self-harm, uh, which in turn made people more sufferable, which caused them even more stress. There, there have been many studies done discussing about the different opportunities or possible cases that remain in the spaces of speech and sound analysis by using AI to combat COVID-19. There, there, there were different speech and sound analysis to help different scenarios in for COVID-19, and only some of them have been found successful, and not everything can be developed in the scenario considering other factors like social distancing and personal and environmental hygiene. Let's start with screening and diagnosing for COVID-19. Let's see, first of all, what is screening and diagnosing? Screening gives an early indication of the presence of a disease, and on the other hand, diagnosing confirms that there is a presence or absence of the disease. Cough detection. The detection is not only of identifying the cough sound and differentiating other sounds such as speech and laughter, but it is also a COVID-19 specific cough. This for this process, it requires we require to collect the COVID and non-COVID cough samples and then develop an AI model that differentiates between both of them. The cough audio samples can be collected from like smartphone mic and other different sort of the same. Uh, and other ma- some other major efforts were also done by some well-known celebrities like universities like Carnegie Mellon University and Cambridge University. They both provided a platform for the population to upload their cough sounds with some additional information like their age, gender, and if whether they have been uh, tested positive for COVID or not. Uh, Breathing analysis, like discussed earlier, some of the symptoms of COVID-19. One of them was shortness of breathing, or not being able to breathe properly, and there were apps designed for capturing breathing patterns and recording their speech signals. And breathing pattern detection was found like one of the application in one of the analyzed lung functionalities as well. Different one of in one of the studies done which showed that they can correlate between high quality speech signals which was captured by earthwork microphone and other signal captured to nexus respiratory diagnosis, which is found under the rib cage and between the abdomen, and measure the cross-sectional area, and through which we can find how the pressure or the breathing can vary between a person who has COVID and not. They also developed a sort of a smartphone-based automatic disease which built around the spirometric test which we give to the patient chatbot. Uh, there are different as the COVID cases increased, and it brought a lot of automation, conversion, and physiology understand of symptoms in a person's individual. So Microsoft and CDC came up with a chatbot named Clara for initial screening of COVID-19 patients by like asking them questions about COVID and capturing the response. This used face recognition and speech synthesis technology. Like for example, Siri, who if you ask the question, "Do I have coronavirus?" based on the it will answer whether or not yes or no. If a person shows severe symptoms, then it is advised by Siri to call 911. In the same way, Alexa was also updated answering the COVID-19 screening, and it differentiates between 20,000 diseases with an accuracy of more than 90,000 and can identify the disease from having similar symptoms with accuracy of at least 96%. Chest X-ray. Multiple different efforts were taken by different groups in direction of developing a classifier to detect the COVID-19 symptom using a chest X-ray. And however, after many studies, a multinational consensus is that the imaging is indicated only for patients with a bad respiratory status. Hence, it was advised to people whose patients who have moderate severe clinic features and a high pretest probability of ease. And it was concluded in various studies that the X-ray findings in COVID-19 patients was to be peaked at around 10 to 12 days from the symptom onset. And on a positive note, in the presence of mobile X-ray machines, this approach was speeding up the diagnosis. However, in CT is still limited for identifying the species virus and distinguishing between different viruses. Now let's talk about monitoring. Monitoring is basically the precautions for stopping the spread of virus. It includes social distancing, wearing masks, and maintaining respiratory hygiene, especially in public places. The concerned authorities they can monitor the population to confirm whether the precautionary measures are adopted by them or not. First is the face mask detection from voice. As we saw earlier from screening and diagnosing, the cough samples were taken, which led to further covering mouth can lead to further spreading of the disease. Mask wearing has to be made mandatory for donating a cough sample, which requires an sort of an app in by the donor, whether wearing a mask or not. To which the result from that challenge will be used to fully develop a voice monitoring tool. It detects the mask or no mask of a speaker, has no mask of the speaker. Uh, Cough and breathing analysis. During quarantine, the doctors needed to monitor the cough history of patients, which can be done with continuous cough monitoring device. After we overcome the crisis, the organization think of resuming the operation continuous monitoring of the common spaces like canteens and lobbies can be so that they can record the COVID specific coughs. Mental health and emotion detection. As the disease spread was so big, so was the uh, so was the mental so were the mental health caused by the different people during the quarantine due to social distancing and many other things. Among several initiatives taken against mental health issues like stress, anxiety, and depression, we as society are yet to see these emotions being analyzed from speech signals during the uh, COVID-19 period. Face mask detection from image. One of the measures while stepping outside home suggested by the World Health Organization was to reduce getting infected or spreading by for getting the virus was to wear a mask. Also, the mathematical analysis which was presented in one of the studies suggested that wearing a mask can reduce transmission of and can help reduce in the peak death rate. Uh, different Several authors provided a masked face detection dataset or real-world masked face recognition dataset, sort of different datasets which use image processing techniques. They have achieved 95% accuracy and in recognized masked faces. And also an Apple Store app developed by Leeway Hearts uh, also can be integrated with the existing setup for an internet protocol camera for getting alerts on detecting no mask on the face. Text analysis. Um, the there are different researchers have been using machine learning techniques to categorize sentiment from the responses to press Genie patient for experience survey. And from this analysis, they found that they express negative comments about the cleanliness and logistics. In a survey done, the Twitter data with 5G coronavirus hashtag is analyzed to understand that the driver of the 5G COVID conspiracy theory and strategies to help in reducing the spread of misinformation circulating in the society. Awareness. Different speech recognition and synthesis algorithms were widely used in the development of chatbots to provide human-like interaction. During this time of crisis, they were helping in spread of the valuable information about COVID-19 to the end user, for which different algorithms were used to bring different information to provide information to the users. And one of a big responsibility as as a part of society is to spread awareness about the disease, whether you have it or not. If you know anything about the disease, it is our responsibility to educate people around us and to let them know how or what can be done regarding the uh, COVID-19. The next steps and challenges. So, as the work culture is more moving towards working from home, and and it is required to detect behavioral uh, problems like fatigue and sleepiness from self-monitoring of working professionals. The behavior parameters like stress or anxiety, they need more attention. Mental health definitely needs more attention during this time. Um, Another major challenge given the social is getting a relevant, accurate speech data for developing machine learning models, which will be used by chatbots, which is speech enabled and gives significant information on the design perspective of it. And there were studies done on and they have expressed a positive effect on the drawbacks associated with using chatbots for sharing the latest information and encouraging desired health impact behavior and basically reducing the psychological damage which is caused by fear and isolation. And another optimistic approach in these difficult times that we can take is to work towards securing a safe environment post COVID-19. And we have to come together as a society to make sure that the future, the future kids that will survive on Earth have reliable resources. This need, this which shows the need of accurate and reliable through which can be done through accurate and reliable screening and monitoring measures at public places. So to conclude the whole section, the topic, there is we definitely need more solutions from the digital sensing space. There is a vast space of physical and mental wellness which needs solution from the digital sensing space, for most of which is speech-based research for screening and COVID-19 are more ready to be customized. Chatbots or which have a large possibility of use cases are still in the need of a big context-aware design, and most of the symptoms are related to respiratory system continuous monitoring of the patients are using audio signal process based techniques and can assist the healthcare providers in providing services while following social distancing norms. And as if we can use audio and speech, text and image together, to we have to create a solution framework which will be more promising for the future, and we can come out of this pandemic as a sort of a sustainable and make it through as happy as we can. Thank you.